Welcome to this educational program. This module discusses dry age-related macular degeneration, or dry AMD. Other modules are available describing other aspects of AMD. This information is taken from a recent review of the medical literature and attempts to be as comprehensive as possible. However, it may not necessarily reflect the experience of your doctor or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. It affects the retina at the back of your eye, and more specifically, an area of the retina called the macula. There are two types of AMD: dry AMD, or early stage, and wet AMD, or advanced stage. Dry AMD is common, accounting for about 90% of cases. It is a slow, painless thinning of the retina. As the delicate tissue of the retina breaks down, the cells needed for vision stop working well. As a result, vision is blurred. Over time, dry AMD can progress to wet AMD, causing significant vision loss. Regular eye exams can help prevent or delay this progression. The retina contains millions of photoreceptors, rod and cone cells, that pick up light and transmit signals to the brain for processing images. Nourishing the photoreceptors is a layer of cells called the retinal pigment epithelium, or RPE. AMD damages the RPE, starving the photoreceptors of nourishment and causing vision loss. Dry AMD is characterized by the presence of drusen, small white or yellowish deposits under the retina. The drusen build up over time and push through the layers of the eye tissue above, disrupting the photoreceptor cells and causing blind spots in central vision. Though you generally will not notice the presence of drusen, your eye doctor should be able to see them during an eye exam. Signs of dry AMD include a slight blurring of vision, a need for more light when reading, blind or blank spots in the center of vision, and an enlarging of these spots over time. Distortion of visual images and loss of contrast may also be noted. Because dry AMD is a slow-progressing and painless condition, it can often go unnoticed until the later, more severe stage of the disease. Also, the eyes are adaptable, meaning that one eye can compensate for vision loss in the other eye. This compensation makes it even more difficult to notice signs of dry AMD. Regular eye checks are critical, as your doctor is able to see early signs of the disease. During an eye exam, your doctor will look for the physical signs of dry AMD: the presence of drusen, an under or over-pigmentation or coloring of the retina, an atrophy or wasting away of the retinal pigment epithelium, or RPE. There is no curative treatment for dry AMD. Instead, it is managed through regular monitoring of vision, risk modification, and the use of low vision aids. To summarize, dry AMD is the slower, more common, and less serious form of AMD. It is caused by the wearing away of retinal tissue. It is characterized by deposits called drusen and may go unnoticed because of its slow pace and absence of pain. There is no curative treatment for dry AMD, so the key to management is to monitor it carefully and take steps to prevent or slow its progression to a more severe form of disease. Other modules are available in this series, including Understanding AMD, Lowering the Risk of Developing AMD, Wet AMD, and Treatment of AMD. There are numerous resources to educate you and help you cope with AMD. This slide lists several of them, including AMD Canada, the American Academy of Ophthalmology, the Canadian Ophthalmological Society, the Canadian Association of Optometrists, the National Coalition for Vision Health, the Eye Club, and the Canadian National Institute for the Blind. We sincerely hope that this module has furthered your understanding of dry, age-related macular degeneration. We wish you the best for the future, and thank you once again for viewing this educational program.